Hi, Gianna Lopez, and I'm here at the Portland Clinic, and we're so fortunate, Portland family is so fortunate to have the Portland Clinic as a partner, and we thank them for their support of community, families, and of course, good health. And we're going to be doing a series of videos that are going to give parents information, helpful tips, and insights into things that we all wonder about at one time or another. Today we're talking to Liz Size, who is the sports medicine coordinator at the Portland Clinic in Tigard. It's fall, and right now kids are engaged in sports, especially football, hockey. And one of the questions that I have, I see my son, he plays soccer, which is not as dangerous as hockey, but concussions are a big question right now for a lot of parents as their kids are engaged in sports. And we were talking a little bit earlier, and you were mentioning something about something called a baseline test, which helps physicians assess where kids are if they have a concussion. So tell me a little bit about baseline testing.
Well, the company that developed the test is called Impact. You can go online and look up some really detailed information that they have for parents. But basically, the Impact test has a baseline component where the kids can come in when they're healthy, they haven't had a concussion, and they take the half-an-hour computer test, and that gives us a baseline, what's normal for them. They do have to be 11 years old to take the test, and they recommend you take the test every 2 years up until the age of 18.
Now, is that because there's so much development in the brain and things that are happening that kids go through?
Exactly.
Okay.
Yeah, the brain's growing so much, and then I think once they hit 18, they're considered an adult, and their standard baseline stays the same. And then they take a test after a concussion. They've got something to compare it to other than just the national norm.
So a kid has some sort of an accident, they get hit in the head, and how do you know that a child might have a concussion? What are some of the signs that are typical to concussion that parents should look for?
Well, one of the main signs is headaches, confusion. There's all different. They can be extra moody, even though kids are typically moody.
Okay, we'll have a baseline testing for moodiness.
Sometimes they'll just say, I just don't feel good. I just don't feel right. Overly sensitive to light and noise. Feeling a little fuzzy or foggy. Those are some of the key words that we tend to ask.
Now, would that be within a certain time frame after an injury has occurred? Like, is there a window, 24 hours, 48 hours, or something parents need to know?
It can be immediately after the injury. They can have some memory loss, or it can be things that will develop within the first 24 hours.
So are there other sports, football's an obvious one, but are there other sports that kids participate in that are concussion prone?
Right. Well, actually soccer, you mentioned soccer earlier, and girls soccer is, I think, in the top 3 for concussions. And so that's a high risk one. We see a lot of lacrosse. We're starting to see some of the ski teams, because they're, it's a traumatic sport. Girls cheerleading, surprisingly, is really high up there.
Well, that's not that surprising. They're up in the air.
Right, with all the stunts, and they're coming down.
Yeah.
So it really is, it's really spreading across the map for the different sports.
Well, and you want your kids to be out there. You want them to be healthy. You don't want to be overly paranoid. You just want to be informed. And Portland Clinic has a lot of great information on their website. They post things on their Facebook often about tips and things. A wealth of information there with the doctors. And is there anything else that you think we should let parents know that would be helpful?
No, I think we've offered this test to the community at cost. It cost us $10. We're doing it for $10 for the baseline, just to get it out there. And it can never hurt to have that. It just stays in the national database, and if you never get hurt, we never have to use it. But if you do get hurt, it's really nice for the doctors to have that tool to help make sure your child gets back to sports safely.
Okay, so go online, portlandclinic.com, take a look, and make an appointment. $10, got some good information. Thank you so much to the Portland Clinic for your time, and thank you, Liz. We appreciate it.
Thank you.
Thanks.